Hello, my name is Barry Sirard, and I'm a third-year medical student at USF. Welcome to my presentation on the impact of body mass index, or BMI, on long-term kidney function following partial nephrectomy. So let's dive into this topic that is vital for both patient outcomes and surgical decisions. Obesity's relationship with kidneys is already pretty well documented. Higher BMI is often linked to declines in kidney function and an increased risk of end-stage kidney disease. Nephron-sparing approaches, like partial nephrectomy, are known to preserve renal function and provide great oncologic outcomes. But what happens when we apply this technique to obese patients? Well, there's mixed evidence and a shortage of evidence on how BMI affects perioperative complications and long-term kidney function. That's where our study comes in. We aim to clarify if BMI impacts kidney function in the short term and long term after partial nephrectomy. So this is the largest single-center study on the topic, and to our knowledge, our population contains more obese patients than any multi-institutional study on the topic. We did a retrospective chart review of 1,307 patients and had 1,221 patients eligible after applying exclusion criteria. We used the appropriate statistical tests to analyze continuous and categorical baseline demographics and perioperative outcomes, and we analyzed BMI both as a continuous and categorical variable in relation to estimated GFR reduction from 1 to 3 months to 36 months. Our BMI categories were normal weight, overweight, category 1 to 2 obesity, and category 3 obesity. For the results, in table 1, you'll find that we did observe increased blood loss with higher BMI, with a p-value of less than 0.001, but there were no significant differences in length of hospital stay or 30-day intervention or readmission rates. You'll find in table 2 significant p-values at 6 months and 9 to 12 months for categorical BMI, 0.02 and 0.048 respectively, but there were no trends in the findings. For example, in the graphs on the right, at 9 to 12 months, normal weight had the highest percent change, followed by overweight, class 1 to 2 obesity, and then class 3 obesity with the least change. You'll see that 36 months is similar in its differences and lack of a clear trend of increasing BMI having an impact. So for continuous BMI, you will see in table 2, univariate linear regression significant at 6 months with p-value of 0.047, but no significant differences in any time point on multivariate analysis. So despite significant differences at specific intervals, based on trends in multivariate analysis, categorical and continuous BMI were not associated with reduction in estimated glomerular filtration rate in the short term or the long term. And in conclusion, in this extensive single-center study, we found that obesity, whether assessed categorically or continuously, did not significantly alter perioperative outcomes or long-term kidney function up to 3 years after partial nephrectomy. Our findings suggest that partial nephrectomy remains a viable option for obese patients, given their increased risk of renal dysfunction over their lifetime. Thank you for listening.